Hi and good morning everyone. My name is Nur Aisyah Kirah binti Zawazi, a third year pharmacy student. Today in this video, I'm going to talk about over-the-counter acne medication, what works and how. I am sure that every one of you have heard about acne. What is acne? Acne is a disease of pilosebaceous units which are found on dermis except in the palms and sole. It is a common dermatological disorder that frequently affects adolescents and later continue into adulthood. Acne can be classified based on its severity, starting from mild, moderate, and severe. Clinically, it is graded according to the types of lesions present, which includes open and closed comedon, papules, pustules, cysts, and nodules. Many people who suffer from acne tend to seek treatment from over-the-counter medication which require no prescription. Thus, it is important for the people to know how over-the-counter acne product works and what ingredients to look for before deciding the best acne treatment. Now, let's go to the main topic of this video, which is the types and functions of over-the-counter medications for acne. There is an array of therapies available over the counter for the management of acne. This includes topical products, essential oil, and vitamin. Let's discuss one by one. First, topical product. Topical treatments are applied to the skin to allow the main ingredient to sink in. It is only active where and when they are applied. It can be used as monotherapy or in combination with other topical acne products, as well as oral agents for initial treatments and maintenance of acne. The topical products include lotion, cream, and gel. It is important to know what active ingredients to look for in this topical agent, which includes benzoyl peroxide, hydroxy acids, sulfur, and salicylic acid. Benzoyl peroxide. It is the most widely used topical agent for acne and used as the first treatment. What is the functions of benzoyl peroxide? It has anti-inflammatory properties and potent bactericidal activities against Propionibacterium acnes, one of the acne causes. In the first picture, it is inflamed acne bumps with Propionibacterium acnes proliferation. When benzoyl peroxide is applied, it will destroy the bacteria. Besides, this benzoyl peroxide has no antibacterial resistance, making it as an ideal adjunct to other topical and prescription antibiotic therapy. It is applied to the affected areas once or twice daily. The possible side effects associated with benzoyl peroxide includes dry skin, peeling, skin sloughing, erythema, and edema. These effects can be reduced by using a lower strength of benzoyl peroxide. It is important to avoid exposure to sunlight as this benzoyl peroxide will increase the skin sensitivity to the sun. Besides, do avoid contact with fabrics and hair as it can cause a bleaching of both. Next is hydroxy acid. Alpha-hydroxy acids used in topical treatments are glycolic acids and lactic acid. Both structures are shown in the slide. What is the functions of these hydroxy acids? First, it treats acne by removing dead skin cells and reducing inflammation. Second, stimulate the growth of new skin, which is useful in the treatment of mild scarring. And third, exhibit mild improvement in non-inflammatory lesions. The possible side effects include mild skin irritation, redness, swelling, itching, and discoloration. Similar to the benzoyl peroxide, hydroxy acids can increase the skin sensitivity to the sun. Therefore, it is wise for the people to avoid the direct exposure to the sunlight by wearing the protective clothes, using umbrella when going out, and also consistently apply sunscreen. Third is salicylic acid. Salicylic acid is a mild comedolating and anti-inflammatory medication. It functions by preventing the pores from becoming clogged. How it works? It exfoliates inside a pore, loosens the clog, and allows oil in the pore to flow out more freely. Salicylic acid is applied once daily or twice daily. The possible side effects that associate with salicylic acid is transient stinging or burning to the skin or irritation. People who use salicylic acid should avoid contact with eyes, mouth, and other mucous membrane or broken skin. They also should use sunscreen and limit the sun exposure. Fourth is sulfur. What is the functions of sulfur? It has antifungal, bacteriostatic, and mild keratolytic properties. It is not effective as monotherapy and is usually combined with other products which are benzoyl peroxides and salicylic acid. Apply a thin layer of 1 to 8% cream, jelly, or lotion containing sulfur onto the affected areas of the skin 1 to 3 times daily. Initiate the therapy with 1 application daily and then gradually increase the frequency to avoid excessive drying. Precautions is required since sulfur can give the unpleasant smell, which limits its use. Apart from topical product, essential oil is also available as over-the-counter acne medication. It includes tea tree oil. Tea tree oil is an essential oil which exhibits broad antimicrobial and antifungal properties. It has several functions. First, to purify pores and control oils. Second, to reduce the number of inflamed and non-inflammation in mild to moderate acne. However, it exhibits slower onsets of actions than benzoyl peroxide. The possible side effects that associates with tea tree oil is skin dryness, itching, stinging, burning, and redness. It is generally safe when applied to the skin but can be unsafe when taken by mouth. Why? It is because ingestion of tea tree oil can be toxic. The final one is vitamin A. Retinoid is a topical form of vitamin A. Example of topical retinoid that is available as over-the-counter medication is differin gel 0.1%, also known as adapalim, a once-daily dose topical treatment. There are few functions of this retinoid. First, reduce the visible lesions. Second, it is comedolytic, which inhibits the development of microcomedones. Third, normalize desquamation by reducing keratinocyte proliferation and promoting differentiation. The possible side effects that associate with this retinoid is skin peeling, irritation or dryness, which typically observed in the first few weeks of treatment and then it will subside. People who use this retinoid is advised to wear sunscreens every single day since this retinoid will increase the skin sensitivity to the sun. Besides, they need to apply a gentle non-comedonic moisturizer for retinoid tolerability. Once people know how over-the-counter acne medication works and what ingredients to look for, they should also know what to expect from the treatment. Sometimes acne will get worse during the first few weeks of treatment and getting better as the treatment is continued. It may take 2 or 3 months of daily use to see the significant results of treatment. If there is no improvement after 3 months, it is advisable to seek doctor or dermatologist for prescription medication. I think that's all from me today. Thank you for listening.